I'm a research scientist within the Kemri Wellcome Trust research program, and my area of research focuses on examining priority setting and resource allocation in public hospitals in Kenya. In the course of doing my research work, I've encountered a number of ethical dilemmas or ethical challenges. And one of the main ethical challenges is the issue of disclosing some of the findings that you gather from the facilities. The nature of the work that I do is sensitive in the sense that I'm really looking at how managers manage the finances that they have in their control and how they allocate it to the different departments. And some of the information that you come across as you investigate this question is sometimes very sensitive and has a potential of putting the managers or the respondents that you're dealing with at risk. So for example, when I was working in the hospitals in Kenya, there were accusations or perceptions of corruption among some of the managers within hospitals. Now, as a researcher, one of the obligations you have is to disseminate the findings that you get from your study. So the question then you ask yourself is, how do you disseminate those findings, especially when you think about the methods that you're using? I use case study methodology, and the thing about case study methodology is that you're required to have a very in-depth description of your subject of study. On a normal day, you would say that the solution to such a dilemma is to anonymize. But then when you try to anonymize, on the other hand, by not putting names and labels, and then on the other, having very deep descriptions of your study subject, then it becomes very difficult to actually claim that you have anonymized, because any keen eye would be able to identify the person that you're talking about.
I'm interested in health system research, focusing on micro-processes of accountability at the peripheral health facilities, specifically the health centers and the dispensaries. I'm interested in the support that the health facility in charges receive from the sub-county managers in terms of support provision. Currently, the sub-county managers are experiencing challenges in terms of resources to this unit because of the devolution. Working with these managers has led to development of relationships, and they see me as part of the system. They see me as part of a researcher, but who identifies with their problems. And one of the issues that they have approached me to support is the issue of transport, providing a vehicle, sometimes just some lunch allowances to enable them to carry out this activity, which is very much appreciated by the facility in charges. And the dilemma is that if I provide a vehicle, it changes the equation, the very thing that I'm being able to study. It also raises expectations on future needs. I don't know, after providing a vehicle, what else they're going to ask.
My name is Benjamin Sofa, and my research work involves understanding the role of decentralization within the health system, and particularly how decentralization is affecting governance for planning and budgeting in the health sector in Kenya. Some of the challenges that I have to deal with in the process of conducting my work is always keeping on reflecting on the information that I get to access, because a lot of it I do access it informally because of the long-term relationships I've developed with the people who I am studying, and a lot of it being provided to me outside the kind of what I would call the safe consent environment, and a number of times trying to understand what does really consent cover, because in all these interactions with them, I do declare and that they have that knowledge that I'm conducting research. But apart from the times when you're doing formal interviews, a lot of the information that you get to be told informally, which significantly contributes into understanding of this research subject, gets to be told to you informally, and always have this dilemma on how do you use that, and asking myself really, is that data, and if it's data, how do you use it, and how do you use it in a way that does not cause harm to the people who provided that information to you, and does not compromise the trust that you have and the relationships that you have developed over a long time.